Good evening, Kafalcos, and welcome to your channel. This is your medic Rio again, and tonight I will be sharing to you an overview on COVID-19 testing. We will be using an on-site rapid test kit by CTK Biotech, and basically the discussion will evolve on rapid test results of IgG or immunoglobulin G and IgM or immunoglobulin M, and all its indications. Certainly, each company has developed a COVID-19 ERP or Emergency Response Plan or COVID-19 Protocol. And tonight I will be using a sheet developed by the company I temporarily deployed at, and I will not reveal the name of the company because it indicates here that this file is private. But this company has used as reference open quotation, purpose, and options for testing for SARS-CoV-2, the COVID-19 virus, colon, considerations for World Bank task teams managing COVID-19 fast-track facility operations, close quotation, published on April 9th of last year, 2020. So, for sure, this is a credible source. And we shall start the discussion with a detail that says virus is usually not detectable before day 3. Again, virus is usually not detectable before day 3. That is the reason why a negative PCR or a negative IgM or IgG do not mean the absence of infection. Because an individual who has this negative PCR, negative IgG and IgM could be on the earliest phase of infection. What is the implication of this? We have to observe at all times still the precautionary measures promoted by different Department of Health or Ministry of Health, such as hand washing, social distancing, wearing of face masks, and many other steps to protect ourselves and to protect others. To proceed, I have with me here an on-site rapid test kit. And when you open it, inside is a cassette. And when you look closely, we have the C, the G, and the M. Now, for the indication of the test results, all these on-site rapid test cassette should have a red on the C line or C area. All cassettes should have the C line. It would indicate that the cassette is working good or functioning good. C means internal control. Then, if no other line appears on either M area or the G area, meaning the individual is negative. This rapid test is only a screening tool and it's not a confirmatory tool to diagnose a COVID-19 case. Again, G means IgG or immunoglobulin G, and M means IgM or immunoglobulin M. Immunoglobulins or antibodies are substances produced by our body to fight the disease, to fight any invaders that are recognized or presumed by our immune system as harmful to our body. Now for the results. If a red line appears on M, but it does not appear on G, meaning an individual is positive for IgM, immunoglobulin M. What does that mean? Patient is infected. A person has a fresh infection, and he is considered to be highly contagious. It's fresh. IgM, or immunoglobulin M, is produced by our body at the earliest phase of infection, within a week or two after the patient or an individual has contacted a virus. Because IgM, or immunoglobulin M, starts to decline 2 weeks after the virus has entered the person's body. On the other hand, if a red line appears on G and does not appear on M, meaning the patient or the person is positive for IgG, or immunoglobulin G. This IgG is produced by the body 2 to 3 weeks after the person has contacted a virus. So these antibodies are mature already. And based on this company's protocol here, when a person is positive for IgG, individual may have had a past infection and has recovered, meaning a PCR test with a negative result should be presented by the crew, and or a rapid test 14 days after he got tested positive for IgG. That's their protocol here. Okay. Now, if both of the red lines appear on IgM and IgG, an individual is still infected. So as per the company's protocol here, he will be isolated and a medical attention will be called as required. Then a repeat antibody test will be done after 7 days. To sum it up, we need to be more cautious and be more careful with those individuals who have tested positive for IgM, or those persons who have tested positive for both IgM and IgG. Meanwhile, we are all susceptible to this COVID-19 virus. So your medic reminds you to practice religiously all health protocols such as social distancing, hand washing, avoid touching our face, nose, and eyes, and of course, the very important wearing of face masks, especially in public places. That's all for tonight, Kafalcos, and thank you for your time. Goodbye.